Nepal nursing licensure. Model questions. Many repeated questions. What is the normal range for adult blood pressure? A. 90/60ths mmHg. B. 110/70 mmHg. C. 120/80 mmHg. D. 140/90 mmHg. Which of the following is a common sign of hypoglycemia? A. Polyuria. B. Polydipsia. C. Tremors. D. Polyphagia. What is the first step in the process of hand hygiene? A. Apply hand sanitizer. B. Rub hands together for 20 seconds. C. Wet hands with water. D. Dry hands with a paper towel. The Glasgow Coma Scale assesses A. Pain level. B. Respiratory rate. C. Level of consciousness. D. Cardiac function. What is the purpose of an incentive spirometer? A. To monitor blood glucose levels. B. To improve lung function. C. To measure blood pressure. D. To administer medication. Which injection site is most commonly used? For intramuscular injections in adults. A. Dorsogluteal. B. Ventrogluteal. C. Deltoid. D. Rectus femoris. What is the primary purpose of a nasogastric tube? A. To deliver medication. B. To assess blood pressure. C. To drain stomach contents. D. To measure body temperature. Which of the following is a common complication of diabetes mellitus? A. Hepatitis. B. Hypoglycemia. C. Hyperthermia. D. Asthma. What is the normal range for adult heart rate? A. 50 to 70 beats per minute. B. 60 to 100 beats per minute. C. 110 to 130 beats per minute. D. 140 to 160 beats per minute. Which of the following is a sign of anaphylaxis? A. Bradycardia. B. Sudden rash. C. Constipation. D. Hypertension. Which type of needle is used for intravenous medications? A. Intradermal needle. B. Subcutaneous needle. C. Intramuscular needle. D. Cannula. What is the primary purpose of using a sterile dressing? A. To provide comfort. B. To prevent infection. C. To absorb fluids. D. To apply pressure. What is the main function of an arterial blood gas (ABG) test? A. To measure blood glucose. B. To assess kidney function. C. To evaluate respiratory function. D. To determine cholesterol levels. Which of the following medications is commonly used to manage hypertension? Insulin. B. Aspirin. C. Lisinopril. D. Antibiotics. How often should you change an intravenous for site to prevent complications? A. Every 24 hours. B. Every 48 hours. C. Every 72 hours. D. Every week. What is the recommended angle for administering an intramuscular injection? A. 15 degrees. B. 30 degrees. C. 45 degrees. D. 90 degrees. What is the primary purpose of using a tracheostomy tube? A. To administer medication. B. To assist with breathing. C. To monitor blood pressure. D. To provide nutrition. Which of the following is an essential component of a nursing care plan? A. Diagnosis. B. Medication orders. C. Patient's diet. D. Personal interests. What is the primary goal of patient education? A. To provide medical treatment. B. To empower patients to manage their health. C. To complete paperwork. D. To monitor vital signs. Which vital sign is typically assessed? First, in a routine physical examination. A. Temperature. B. Blood pressure. C. Respiratory rate. D. Pulse. What is the most common cause of pressure ulcers? Poor nutrition. B. Inadequate hydration. C. Prolonged pressure on the skin. D. Infections. What type of infection control precaution is used when dealing with bodily fluids? A. Standard precautions. B. Airborne precautions. C. Droplet precautions. D. Contact precautions. Which of the following is a common symptom of pneumonia? A. Constipation. B. Productive cough. C. Tachycardia. D. Skin rash. In which situation would you use a 25-gauge needle? A. Intramuscular injection. B. Subcutaneous injection. C. Intravenous injection. D. Intradermal injection. What is the first-line treatment for a patient with anaphylaxis? A. Oral antihistamines. B. Intravenous fluids. C. Epinephrine injection. D. Corticosteroids. Which diagnostic test is used to evaluate kidney function? A. Complete blood count, CBC. B. Electrocardiogram, ECG. C. Serum creatinine. D. Liver function test, LFT. What is the primary concern when caring for a patient with a tracheostomy tube? A. Ensuring proper nutrition. B. Maintaining airway patency and cleanliness. C. Monitoring skin temperature. D. Checking for signs of jaundice. You need to administer 0.75 liters of intravenous fluid. How many milliliters will you administer? A. 75 ml. B. 150 ml. C. 500 ml. D. 750 milliliters. A patient is to receive 1,200 milliliters of fluid over 8 hours. What is the flow rate in ml per hour? A. 100 ml slash HRB, 150 ml slash HRC, 200 ml slash HRD, 250 milliliters per hour. What is the correct position for a patient undergoing a lumbar puncture? Prone position. B. Supine with legs extended. C. Lateral recumbent with knees drawn to the chest. D. Sitting upright with legs dangling. Thank you. Follow for more. Best wishes.